So what we're trying to do is develop pre-hospital staff or pre-hospital provider course so that we have pre-hospital teams that are now trained and built up to actually be prepared for COVID-19 in the event there is reinfection and also a surge in infections in the nation. So the whole idea of the course, the main objective is getting us prepared, number one. The preparation includes having all providers to have an in-depth knowledge of COVID-19, the infections. Second is to understand the infection control practices that they need to be prepared for when they have been designated by the EOCs that have been already set up in the Ministry of Health. They're designated to go and pick up a patient who is infected or suspected case or probable case or a highly infective case. So the whole idea is preparing our staff. All pre-hospital staff need to be trained in being able to prepare and protect themselves before they go out, how they actually go and get the patient and being able to put them in the vehicle and transport them safely to the designated healthcare facilities. The other aspect is the psychological aspect. We want to also prepare the teams to be able to deal with families. So you go into families, there's a lot of heightened emotion. So being able to deal with families in a safe manner and being able to extract the patients so that they are brought to the designated facility. And also taking patients from a designated facility to another higher facility or a lower facility. So we want everybody to be available, because if there's a surge, we want to be able to make sure that there are teams available. Not just one team, every team is available. And not only that, but there's intercommunication. So also during this time, we also will be talking about communication, how we communicate between teams, how we use dispatch. We're going to be looking at dispatch medical checks. So when they get information, that's another area that we'll be doing next week, is what information are we going to get from the EOCs? And that information, how do we transfer that information to prepare ourselves to go and attend a medevac that needs to be picked up and then brought to the designated area. Sure that they go through the training of putting on PPE, so personal protective equipment, so gowning up, and also we also want to ensure that when they also put on the equipment, they know how to take it off safely, so that they do not cause themselves to be infected at the same time. So we want to pay attention to details. So that's the reason why we're doing the next session, which is next week. I just want to take this time to really thank Commander of the Military Forces and also the Police Commandant and also the authorities from fire and also Commissioner of Prisons for allowing these teams to come. Because today is, something different. We're setting a pace again for teams to be trained well. It's been a long while. We haven't had this training. And I think it's high time we're taking seriously about our ambulance and pre-hospital services.